You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events.
Deputy Secretary Julie Willems Van Dijk. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases, and Ryan Nilesestuen, the Chief Legal Counsel in the Office of the Governor. And we'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks for joining us again today. So far, more than 245 million doses of the vaccine have been given across the nation, with more than 4.5 million of those doses right here in Wisconsin. Folks, this is really great news and we're headed in the right direction, but I know we can do even better. Summer is right around the corner, and getting vaccinated will allow us to get back to all the gatherings and events we all miss safely. Whether it's a summer family reunion, a concert with your favorite band, 4th of July celebrations, or for me and Kathy, having a cream puff at the state fair, our ability to do so safely without masks and with all the fun we miss depends on as many people as possible getting vaccinated. Depends on you. More than 2 million Wisconsinites have completed their vaccine series. That's 2 million of your friends, family members, and neighbors, most with minimal side effects. And those side effects are a great sign that your body is building up protection and that the vaccine is working. For more than a century, we have used vaccines to protect from disease, and these COVID-19 vaccines have undergone and will continue to undergo the most intensive safety monitoring in U.S. history. So if you've been waiting to get your COVID-19 vaccine, it's a great time to do it right now. Any one of the approved COVID-19 vaccines is safe, effective, free, and it's the most valuable tool we have to save lives and stop the spread, and to ensure our state and our economy bounces back and better, and to get us back to what we were doing sooner. If you're an employer, help encourage your employees to get vaccinated by setting up a vaccination clinic at your business with the help of your local county health department. If you're headed out to get your vaccine, invite a friend or a loved one to come along. And if you're still considering it, head over to the CDC and DHS websites and learn more about how safe and effective these vaccines are, and then go get vaccinated. Even if you're young, even if you're healthy, even if you've already had COVID, go get vaccinated. Because I can't tell you how many times I've said it over the past year, but kicking this pandemic to the curb is going to take all of us together. Public health is a team sport, and we need you to help us get this done. Vaccine providers across the state have opened their doors to walk-in appointments, and many have appointments available. So head to vaccines.gov and find a COVID-19 vaccine near you. And don't forget to complete your vaccine series. Let's get vaccinated, Wisconsin. for each other, for our small businesses, for the future of our state, and let's get this done. With that, I will now hand things over to Deputy Secretary Julie Willems Van Dijk. Julie, it's all yours.
Well, thank you very much, Governor, and good afternoon, and thank you for joining us. So as of today, we have administered 4,751,017 doses of COVID-19 vaccine in our state. As the governor said, 2,265,706 Wisconsin residents have completed their vaccine series. We're making progress, and every dose administered moves us further down the road to the other side of this pandemic. Of course, the more people eligible for vaccine, the more progress we can make, and that is why we are all eagerly awaiting the outcome of this afternoon's meeting of the Advisory Committee on Immunization Practice, a group of independent experts who advise the CDC on vaccine recommendations. The Food and Drug Administration expanded the emergency use authorization for the Pfizer vaccine on Monday to include children ages 12 to 15. And the ACIP is currently meeting to issue the clinical guidelines for this expansion. As soon as ACIP releases their guidelines, DHS will be ready. If the guidelines are as simple as an expansion of the age range, then we will update the standing order tonight and vaccinations can begin tomorrow. If the guidelines contain additional clinical considerations that are unique to this new age group, we'll be ready to move forward as soon as they are released in the MMWR, or the Morbidity and Mortality Weekly Report, which will come out later this week. This decision might come as we are briefing you. Either way, the most important information to share right now is this. Trials show that the Pfizer vaccine is 100% effective in preventing infection in children aged 12 to 15. And that is very, very good news, especially since we have seen an increase in cases among children recently. Vaccinating children in this age group will prevent individual illness and help stop the spread among our children and in our communities. For the parents and guardians out there, now is the time to start planning how to get your 12, 13, 14, 15, 16, and 17-year-olds vaccinated. There are a few things to keep in mind. Some are the same as every vaccination for your child, and others are more specific to COVID-19. Just like with all vaccinations in Wisconsin, your child will need parental or guardian consent to get the COVID-19 vaccine. And just like with all your vaccinations, your child's pediatrician is a great source of information if you have any questions or concerns. Only the Pfizer vaccine is authorized for this age group. So Vaccine Finder, which has a new and even easier to remember website now, vaccines.gov, is a great tool to help you find it. Again, that's go to vaccines.gov, click Find COVID-19 Vaccines, and then filter your search to include only the Pfizer vaccine before you enter your zip code. Our vaccine hotline can also help you find an appointment at 1-844-684-1064, 1-844-684-1064. DHS.wisconsin.gov/vaccine has a wealth of information about vaccine safety and efficacy, what you should expect during your appointment and after your shot, and links to our vaccine data page. Our team is working on fact sheets for parents even as we speak, and those will be uploaded as soon as we hear more details from ACIP. As we continue our vaccination effort, we also need to remember that COVID-19 is still present and spreading in Wisconsin, and that we all need to do our part to stop it in its tracks. That means getting vaccinated, washing our hands, wearing a mask, and physically distancing. Today, we are adding 558 new confirmed cases, which brings our total confirmed cases of COVID-19 to 604,378 people. Our 7-day average of new cases is 491. As of today, we have lost 6,935 Wisconsin residents to COVID-19. Our thoughts go out to their families and friends as we all recommit to doing everything we can to stop the spread. And with that, I'll turn it back to Jennifer for your questions.
Thank you. And a reminder to maintain audio quality. Please keep your phones on mute until it is time to ask your question. A note that we do need to conclude the briefing at 2:15 this afternoon, so in the interest of time, please one question per reporter. And we'll begin this afternoon with Kent Wayne Scott from WISN TV in Milwaukee. Kent?
Good afternoon. Thanks for taking my call. I just am curious about the rate of vaccinations. You talked about the number that have been vaccinated, but we've seen pop-up and mobile clinics, outreach into communities, and still a large number of people remain unvaccinated, and the rate seems to be leveling off. So are any new approaches being considered to boost those numbers, things that haven't been done yet? And once younger people have access to the vaccine, do you anticipate that rate of vaccination being any higher than what we've seen so far with the older population?
Well, it's always hard to predict what will happen in the future, but we always hope that the rate of vaccine for each group will get higher and higher. You know, I think it's important to remember as we look at the pace of vaccination getting a bit slower is the rapid pace which we've had up until this point. And it's been much quicker and much faster than I think any of us could have anticipated. And so now, as we say, the hard part begins, which is we find a lot of different creative ways to do pop-up clinics, to bring vaccine to where people are at, to have more conversations with folks who are still making up their mind about vaccine. And that just means we have to do it for more days and fewer people per day. And, you know, if you think about it, if you're going to do a pop-up clinic in a grocery store, or as I heard today in Eau Claire, at a bar, or at a neighborhood center, you're probably going to see, 50, 100 people. And compare that to some of our mass vaccination clinic sites and some of our health systems that we're doing 1,000, even 2,000 doses a day. It's going to take us longer to get there with those smaller sites. But this is a long journey, and we'll continue to make progress one step at a time. And we're really eager to invite the 12 to 15-year-olds into this fold. And if 12 to 15-year-olds' parents haven't gotten vaccinated, great time to make this a family event and have everyone get vaccinated together.
Thank you. Now to Todd Richmond from the Associated Press. Todd?
Hi there, Governor. Two questions in one. So what do you make of the news that you're going to be receiving $700 million less in stimulus funding? How does that change your spending plans? And also, what do you make of the election bills that the legislature passed yesterday? Thanks.
Thanks, Todd. And I obviously, that $700 million makes a difference. That's $700 million that we can't help people, our small businesses and others, to recover as quickly as we wanted to. The good news is that it's based on, frankly, our unemployment rate, which is strong, and it's been strong, comparatively strong to other states all along. So but it still hurts, and so the buckets I think are pretty well defined already. That we'll be using it. It may impact some of the amounts, but when we think about the areas of the state that have been struggling so mightily, it's small businesses, Main Street businesses, bars, restaurants, and so on. And we will continue to we will continue to make sure that they are a priority, even with the $700 million less. That said, we are also, we're going to do whatever we can to continue to coordinate with local governments to make sure that what we're doing and what they are doing is in concert, so that we aren't stepping on each other's toes, and we can do things together and make a dollar work in the best way possible. Regarding the election bills passed yesterday, we'll take a look at them when they arrive here in my desk, and I'm just hopeful that any bill that's being passed will enhance people's ability to vote rather than detract from that, and that's what I'll be looking at when I see them. But until I see them on my desk, I won't comment on whether I'm going to sign or not. But I've made myself clear right from the beginning is that getting more people to vote in a democracy is a good thing.
Thank you. Now to Stephanie Hoff from West Politics. Stephanie?
Hi, and thanks for taking my call this afternoon. My question is for Governor Tony Evers. When are you going to say that we can stop wearing masks?
That's a great question. When it's safe. There are places I don't wear a mask now. I am now in a building, in a smaller room, and I'll wear a mask in those situations. We don't have a mask mandate in the state, in case you didn't know that, and so we're relying on our local public health officers to make their recommendations known, and I think they're doing a great job. So we will continue to wear masks. I will continue to wear a mask if I'm in a situation where I feel it is warranted. I've been vaccinated twice, and we're beyond the 14 days easily, and so when I'm outside, I don't wear a mask. When I'm inside of the executive residence, I usually don't, because the people that work there aren't working there. And when I'm in the Capitol here in my office, I will usually wear a mask because we have people coming in that I'm not sure whether they're vaccinated or not.
Thank you, Stephanie. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding and taking my call. There have been some reports that vaccinators are ordering a fraction of doses available to the state. Can you talk a little bit about how many doses are people ordering for next week, and do you expect the approval of the Pfizer for 12 to 15-year-olds leading to any increase in dose ordering? Thank you.
Yeah, great question, Sean. We've seen a significant reduction in the requests from our vaccinators, and in this current week, we ordered about 13% of what was allocated to us from the federal government. One of the reasons that number is so much lower, however, is because a number of our vaccinators have significant supply and inventory. They had ordered larger amounts of vaccine and then experienced this decline in demand from the public. And so they wanted to basically spend down their savings account of the inventory of vaccine that they had before ordering more. We're also facing a situation where some of the vaccine, particularly the J&J vaccine, we're getting closer to its expiration date in June. And so wanting to use, first in, first out management of the inventory there. I do expect we'll see increases in the upcoming weeks. We've heard that from several vaccinators, that now their inventories are getting spent down and they'll need to be ordering. They wanted to be sure that if they missed a week of ordering, that they would still be eligible. And of course, that is true. We have plenty of vaccine for all of our vaccinators. And we do believe that the new population, which is a little bit over 300,000 people who are now newly eligible in the state, will result in our vaccinators requesting more Pfizer vaccine. And we have plenty of Pfizer vaccine in our allocation in order to accommodate those increased requests.
Thank you, Sean. Now to Brittany Schmidt from WBAY TV in Green Bay. Brittany?
Hi, I was just wondering, you talk about now with the vaccinators not asking as much because we got inventory, but we know that the numbers are kind of plateauing, so to speak. Do you think there's also a sense of complacency where people are just not as urgent to get it because restrictions are easing up, it's warmer weather, more outdoor activities? Do you think there's a sense of that in the community as well?
Well, I think it's hard to pin the decreased demand on any one single thing. It's multiple factors. But I do think it is fair to say, the urgency we saw in people wanting to get the vaccine in December and January and February and March and April was largely related to people who were very concerned about contracting COVID and having serious outcomes from it, including losing their lives. And so who did we hear from? We heard from older adults who knew that 87% of our deaths had been in people over age 65. We heard from people with comorbidities or diseases that would predispose them towards hospitalization and death. And so that first group of people who received the vaccine, we heard from healthcare workers who were taking care of people, and other workers who were exposed in the course of their daily workday to the potential for infection. So that first group of people felt very threatened by COVID-19, and they came very quickly, very urgently, and now we are facing a population that may just not feel quite as threatened by the disease. If you look at our data, you will see by each decade of years, it gets a little lower and a little lower in terms of the uptake. And that makes sense if you look at the risk of death from this disease. What I'd say to people is the vaccines are safe, the side effects are mild, and if you take that vaccine, you're not only protecting yourself, you're protecting others in the community, other loved ones, other people who can't get the vaccine because of medical contraindications, and you contribute to guarding against the mutation of this virus so that we won't end up with a COVID-19 variant that is even more lethal. And those are all really important reasons why, even if you don't feel particularly threatened by COVID-19 right now, it would be really great to consider getting this vaccine to help protect against even more serious mutations or variants in the future. So let's link arms and roll up our sleeves and keep working on it. And again, it's not like we have to have it done by Memorial Day. We can keep on, people can do it at a time that's convenient for them, and we really encourage people to consider that and find that time, whether it be May, June, July, as soon as you can in the coming months.
Thank you. Now to Heather Poltrock from WSAW-TV in Wausau. Heather?
Thank you. Why are people who have already had COVID not factored into herd immunity equations?
I would say that they are.
Yeah.
When we calculate herd, the concept of herd immunity is people who are protected because of generally circulating antibodies, which are the immune system's protection, and you get those from both vaccination and, to a potentially variable degree, but for this infection we know to a large degree, by natural infection. So the concept of herd immunity does include both, and so calculations about what that level is should include both.
Now to Mason Dowling from WAOW-TV in Wausau. Mason?
Hi, thanks for taking my call. Had a question for either Dr. Westergaard or just DHS in general. Specifically, it seems like when the variant cases are listed on the DHS's website for county health departments, basically, how long does it take to actually sequence those tests for suspected variant cases? Because it seems like it happens kind of randomly between the variants.
That's a good question. It can take about a week, probably at the short end, between the time a sample is collected from a patient who ultimately tests positive and for the sequence data, the genetic information, to get uploaded. And that's because if there's multiple steps in the process, first the diagnostic test has to be positive, and that can take several days. And then once that initial PCR test is positive from the diagnostic test, the residual, the leftover sample, then needs to go often to a different lab, a specialty lab, which does a more sophisticated type of test called whole genome sequencing. That test itself can take several days and is more labor intensive. And it generates a very large amount of data that requires specialized staff and software to analyze. It then gets uploaded to a global data repository called GISAID, where all of the sequencings from all of the countries that are doing this work gets done, and then we identify it as and can be classified as one of the variants of interest or variants of concern. So that whole process can take some time. And I would say, at the short end, it can take a week, but some of the sequences that get generated are done even longer after the fact. For example, we may do sequencing on specimens that has been stored for some period of time because of a specific investigation. So that's why there's such variability, because it takes some time to both generate the data, and there can be a lag when we decide which specimens get sequenced.
Thank you, Mason. Now to Aaron Mabin from Fox 6 in Milwaukee. Aaron?
Hello. Excuse me. If the Pfizer vaccine is approved for use for those aged 12 to 15, how many more people will become eligible? And is there enough Pfizer vaccine on hand in the state for families to get their teens vaccinated?
Yes, there's plenty of vaccine available. It will add about 300,000 people to our eligible population. Between the vaccine that we have in storage and the vaccine that we have available to order, we'll have plenty of vaccine.
Thank you, Aaron. Now to Elizabeth Wattis from NBC 15 in Madison. Elizabeth.
Yeah, a logistics question. Assuming eligibility is expanding to 12 to 15-year-olds, what role will schools play in getting kids their first dose? And then what happens with the second dose when school is out?
So that will vary from community to community. I know a number of our, just as our local health departments served as the key strategist in helping school staff and teachers get vaccinated, many are working with local school districts to set up vaccination clinics for students in their school district. That, again, it will vary from school district to school district. There is 3 weeks between the first and second dose. I think that's partly why we're hearing vaccinators so eager to begin vaccination. I know there are people ready to begin tomorrow. I even heard there's some people ready to begin this evening. And I think the reason they want to get going as quickly as possible is so that they have the opportunity to do the second dose while school is still in session. Many school districts are meeting into early June. And so that's one reason people are trying to get this first dose done very, very quickly. If the school is no longer in session, people are eligible to get their second dose at any other vaccinator who has Pfizer vaccine. And we've been working with our vaccinators throughout the state to liberally administer second doses for people who had their first dose somewhere else. And with our current vaccine supply, that is not presenting an issue.
Thank you. Now to Denise Lockwood from Racine County I. Denise?
Thanks for taking my question. So my question is in regards to the kiddos and really trying to understand the infection rate with the variant, but also wanted to understand what the capacity is in the pediatric units, and how resilient is that system to be able to respond to outbreaks within kids.
Dr. Westergaard?
Sure. So the first part of the question was about the potentially the changes in infection rate because of the new genetic variants. Well, what I would say is that what we learned from studying the new genetic variants is that they're more transmissible, so they spread more quickly in a community. And what we've seen in various countries and in this country is that when those variants become the predominant strain, we see upticks in the epidemic curve. And our neighbors in Michigan had a pretty substantial increase in their curve over the past month or two. That was pretty concerning, and it coincided with the B.1.1.7 variant becoming the predominant strain. So we saw a relatively small uptick, not anywhere near that, which was very good sign. But we actually did at the same time see that the B.1.1.7 and these other variants of concern have become the predominant strain. So that has translated to a higher number of infections, and the age group that is the highest number of infections per age category is now children under 18. Now, I think that's partly because they are the least likely to be vaccinated, but we do know that these variants are more infectious among all age groups. So I think that's probably those two reasons are why we've seen higher proportions of infections in younger children. Now, we should also say that the number of infections in children at this moment is still not as high as it was in November, December. All infections and hospitalizations are down in all age groups, which is a very, very good thing. But it's just proportionally, the younger age groups have a bigger piece of the pie. And there's no concern that we're familiar with talking to our hospital partners about limited capacity for critical care beds in pediatric hospitals right now.
Thank you, Denise. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yeah, hi. Thanks for taking my call. I know that a few weeks ago, the target that was generally mentioned was 80%. You'd like to see 80% of the state vaccinated. Given the slowdown in vaccination numbers, I was wondering if there was a new target number where you would like to see the state realistically vaccinated at. Thank you.
Nope. That's still the target.
Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking the question. I have been looking at the numbers, and it really looks like the rate has kind of leveled off, a little bit up, a little bit down, but is kind of at about the same broad level for the last several weeks now. Is it beginning to feel like this is maybe just we're going to be plateauing at this level for a fairly long time until more vaccinations occur and therefore it comes down as a result of that? Or are there reasons to believe otherwise?
Well, I very much hope that this is not the new normal, because people are still dying of COVID-19, and we've had days and weeks where dozens or more than 10, 20 people have been reported dead. So this is a preventable disease, and anytime someone passes away from this infection, it's a tragedy, and all the more that it's a preventable tragedy, I think should motivate us to continue to try to, flatten the curve, stomp the curve as low as we can. Right now, 500-600 cases a day is too high. It means there's enough virus circulating in the community that vulnerable, unvaccinated people could become infected, and we can lose people who don't need to die. So no, I think we don't rest. We keep working hard. We try to do the things that we've put in place to test, to do contact tracing, to recommendations about quarantine and isolation, and we continue to emphasize vaccination for all people. When we do that, we're going to save people's lives, and it's worth it for the foreseeable future until we get to very, very low levels of transmission.
And that is exactly why we are not lowering our target for vaccination, because we still need more people vaccinated in order to save lives.
Thank you. And now to Rose Schmidt from CBS 58 in Milwaukee. Rose?
Hi, thanks for taking my question. Another follow-up to the question about the ACIP announcement that we're expecting for 12 to 15-year-olds. What will this mean for our state's ability to reduce transmission of the virus? And what would you say to parents who are still on the fence about getting their teens vaccinated? Thanks.
Well, it's another step forward in, again, expanding the number of people who are protected against this virus, reducing the reservoir of people where the virus can get, infect and mutate and change and potentially become more lethal. And it protects a group of children who currently don't have eligibility for the vaccine. So it's a very safe vaccine, and it's a very effective vaccine. In the clinical trials for this age group, nobody who received the vaccine was infected with COVID-19. You can't get any better than that. And so, I think of, as a parent, if I had a child that age, I would absolutely be front in line bringing my child to be protected from a virus that we know can be lethal even for children, and can be prevented with a very, very safe vaccine.
If I could, I'll share that I am a parent of a 12-year-old, and we've tentatively, pending to this afternoon's decision, made an appointment for him tomorrow. We'll of course have to cancel it if we have to wait because of the policy. But in our family, it's something that we've talked about, repeatedly for months and months about when can children get the vaccine, and we have full confidence in the vaccine. My wife's also a physician, and it's something that we're celebrating amongst ourselves. That now one of our children, we have two that are under 12, unfortunately, so they're not ready yet for a bit. But it's a very positive thing, and our family and our community, I think, will be better off when we can get more young people vaccinated.
Thank you. Now to Ben Crumholtz from Fox 11 in Green Bay. Ben? Fox 11?
Hi, thank you for the opportunity. We're hearing from businesses and communities who are not extending their mask mandates. And the reason for that we're hearing is, well, there's been enough opportunity for people to get vaccinated. What do you think about that reasoning? Can you hear me? Much better. Sorry. We're hearing from some businesses and communities who are dropping their mask mandates that a reason is people have had plenty of opportunity to get vaccinated. What do you think of that reasoning?
What do we think of that reasoning? Was that the final part of that question? Well, we still have a whole bunch that aren't. And so just following the reasonable guidelines that most of our local health officials are espousing, and the CDC, they still talk about what circumstances you do need to wear a mask. So, we're not anywhere near done here, and we still have to be smart about wearing a mask.
Thank you. Now to Riley Vetterkind from Wisconsin State Journal. Riley.
Hi, thanks for doing this. Governor Evers, I'm just wondering how likely it is that you might end up using some of the stimulus funds to pay people to get the COVID vaccine if you're still trying to drive up those rates in the coming months.
Well, we'll never say never about any opportunity to convince people to do it, and so I can't answer that question completely because we haven't reached that point, but we will do everything within our power to get people to get shots in their arms.
Thank you. Now to Jonathan Krause from WHPY in Appleton. Jonathan. WHBY. Okay, moving on then to Olivia Stern from Up North News. Olivia.
Hi, thank you. With mass vaccination sites winding down, what is the best way for vaccinators to reach these underserved or hesitant communities that are seeing disproportionately lower vaccination rates?
Well, I think one of the best ways to do that is to go to where people are. And you're seeing around the state vaccinators aligning with employers and going to work sites. We all have to go to work every day, and that's a great place to get vaccinated. Really have seen great work from our employers supporting their employees in getting vaccinated, giving them time off if they have side effects, and really encourage more employers to make that service available and make those accommodations for their employees. We've been going to churches, vaccinators have been going to community centers. As I said, vaccinators are going to malls and shopping areas and farmers markets and as I mentioned earlier, even bars and Brewers games and Bucks games. And I hope we have a vaccination center at the state fair and at every county fair as we approach the summer. So it's a matter of going where people are. I also want to remind people, almost all our pharmacies still have vaccine. Pharmacies, and many of them are doing walk-up appointments. So pharmacies throughout the state have vaccine. They're open many hours outside of a normal workday and are a great source for you. And your local physician is likely to have vaccine too. So don't hesitate to call and make an appointment with your regular healthcare provider as well.
Thank you. Now to AJ Bayatpoor from WKOW-TV in Madison. AJ.
Good afternoon, Governor. This question is for you. With the news that the state's getting $700 million less than expected, how does that affect specifically the $500 million that you kind of bookmark for ongoing pandemic assistance, or would you look at scaling down that bucket along with the infrastructure and economic relief areas as well?
The announcements we made previous to this news we received yesterday still are where we want to be. You know, we'll take another look at that, but those first ones were, you know, around small business recovery grants and Main Street grants and so on. We believe we can still honor those commitments.
Thank you, AJ. Now to Jonathan Neiser from NBC 26 in Green Bay. Jonathan?
Yes, I believe the state is tracking this data, and I'm just curious if you could get an update on the percentage of vaccinated people who have gone on to test positive for COVID-19.
We are tracking that. We are working through the data matching to make it more automated and accurate. And so I don't have an updated number for you, Dr. Westergaard.
We'll be sharing that within a week or two, updated number, yes.
Thank you. Now to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo?
Hi, good afternoon. I just wanted to follow up on something that Deputy Secretary had said earlier regarding as soon as the ACIP releases its guidelines, DHS will be ready. I know we've heard from some local health departments and how they're preparing or what they're waiting on. Can you just give us a better idea of what DHS's role and activity will look like once those guidelines are released? Thank you.
Yeah, our local health departments provide immunizations based on the policies and procedures, and many of them by the standing order that Dr. Westergaard signs in order to administer vaccines through their local health departments. So you could say we're joined at the hip. And so they are waiting for us to update those guidelines based on the decision from the Advisory Committee on Immunization Practice. Other practitioners are look to us for guidance on this. This is a brand new vaccine, and we're their pipeline to the FDA and the CDC, and so they look to us for that guidance as well, although they are not bound by our policies, procedures in the same clinical way that our local health departments are. So we're updating those, we're preparing emails, we're preparing press releases, we're preparing website updates. So the team, as we speak, is doing all of that work to be prepared with what is issued. But please remember, we can't finalize it until the guidance is actually issued. So as I said earlier, if it's merely changing the age to 12 years and older, that's pretty simple. If they make other changes to the guidance, that will take a bit longer, and we want to be really clear we've got it right, and we've seen what those explicit clinical changes are based on the counsel of these national experts.
Thank you. And our final question this afternoon belongs to Drake Bentley from the Milwaukee Journal-Sentinel. Drake?
Hi, Governor Evers. Regarding the $700 million that the state is now, less going to receive, do you have any specifics on what groups will be affected most? And has there been any movement in regards to that payment being two payments?
No movement. I'll answer the last question first. No movement yet. We know the Treasury Department has received our request, and that is a really important piece of the puzzle here, because if we have to wait for half of the money, that will create some differences in what announcements we make about which other categories we're going to be looking at. So we really do need to find that out, because, just in my opinion, we need that money now, period. And waiting a year, we'll have to do some prioritizing, obviously.
Thank you. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.